An abdominal aortic aneurysm is known as the silent killer because half of the people who develop one die before reaching the hospital.
An aneurysm occurs when the aorta swells up, it weakens. And it occurs, you actually get a balloon effect where the aorta is swelling and it's weakening. And eventually this can lead to rupture. Obviously when it ruptures, there's a significant blood loss and that leads to a rapid death.
Dr. Dudley Strickland is investigating whether certain genetic mutations might increase the risk of abdominal aneurysms, which follow a weakening of the artery wall.
The elastic lamina is composed of a protein called elastin, and it's a matrix it gives the aorta its elastic properties. So once it starts getting degraded, you start getting a weakening of the vessel, and that leads to this swelling.
In a study using mice, researchers determined that the LRP1 protein is a likely suspect. When the LRP1 protein was genetically knocked out, the mice developed abdominal aneurysms 100% of the time. The next step is to conduct genetic studies in humans who also have the LRP1 protein.
What we were proposed to do is to identify patients and start a genetic screen of LRP to see if we can find any mutations that might occur in this protein that correlate with aneurysm formation. And if so, then we can develop genetic tests to identify and make predictions about whether this will occur in humans or not.
Researchers plan to perform DNA sequencing to determine if these patients have mutations in LRP1 and in other genes thought to play a causative role in abdominal aneurysms. For the University of Maryland School of Medicine, I'm Larry Roberts.